Let's come back to this now. The SANDF will be deployed to help fight COVID-19 in the Western Cape. It will provide doctors and nurses and help with law enforcement and infrastructure. ENCA's Aisha Ismail is in Cape Town with more on that story. And Lentegeur Hospital in Mitchell's Plain, Hospital of Hope. Aisha Ismail, talk to me about where exactly these SANDF deployees will be useful. That hospital there, I imagine, will be one of the areas where their presence will likely be felt as the country and the province responds to the second wave of the virus.
So, Tulasizwe, this morning I spoke to the Premier of the Western Cape, Alan Winde, who visited this facility here in Lentegeur, and he was telling me that the military responded positively to a request from the province, and that the military doctors, healthcare workers will deploy in areas where needed. Now, while he didn't mention this hospital specifically, he did say that they would probably be going to an area like Paarl and Worcester, more to rural areas where the military doctors and nurses will be needed. At this facility, for instance, the health authorities have made use of the existing infrastructure. They've turned 2 wards into 2 dedicated COVID-19 wards. They received 200 beds with the help of NGOs and, of course, from the gift of the givers. They're also equipping this facility with oxygen. Now, just to give you an example also, the Western Cape at the moment has over 40,000 active infections. More than 3,000 COVID-19 patients are in acute hospitals. And of course, we're seeing an average of over 100 deaths a day. We're also using more and more oxygen. And again, to give you an example, in July, the Western Cape state hospitals, public hospitals, used 27 tons of oxygen a day. Now they're using 48 tons of oxygen, and as you can see at the back, there's a huge oxygen tank going up here. Tulasizwe, we know that oxygen is important, and Afrox, the company supplying the Western Cape with oxygen, has been asked by the provincial government and provincial health authorities to make sure that there is enough oxygen for this province, so much so that Afrox has also now put in place contingency plans to make sure that there is enough oxygen, especially as the Western Cape is expected to start peaking this week. So, as I said, that authorities are making sure that they have enough staff, that they have enough beds, and as we said earlier, they've asked the military for help, and that request has been answered, and we will be able to see the military being deployed, if not today, well, at least by tomorrow. But everybody's also asking about what has happened to the Cuban doctors. Well, there were 26 Cuban doctors deployed to the Western Cape during the first wave, and they are still around. Some of them are in Paarl Hospital, and I'm told that some of them are actually here at this facility in Lentegeur at the Mitchell's Plain Hospital of Hope.
And I imagine that from your conversation with the Premier, Aisha, and other officials in the Western Cape, you are getting a picture of what the state of play is at the various hospitals, right?
That is correct. And what they're saying also, yesterday I was listening to the Premier's Digicon, which he has every week to inform the people of the Western Cape about what the state of affairs, what's going on in terms of COVID-19 in this province. The head of health, Dr. Keith Clute, did point out that the Garden route, for instance, we're seeing a stabilization of infections, although infections are still really high. They are concerned, of course, about the Karoo, also the Winelands and the West Coast, where we're seeing infections still very high. Infections are still very high in the metro, and sadly, as we reach our peak, we will be seeing more infections, more hospitalizations and more deaths. But they're taking no chances. They're getting in more beds. They're getting more staff in place, and to deal with the rapid increase of COVID-19 infections. And of course, I didn't miss the opportunity to ask asked the Premier about vaccines, and he was saying that while they will be working with national government, there is absolutely nothing stopping the Western Cape from also sourcing and actively looking for vaccines so that people in this province can be vaccinated as soon as possible. Of course, those vaccines must be SAPRA approved, and they will be working hand in hand with the National Minister of Health as well as the National Health Department.
All right, thank you for that update. That's ENCA's Aisha Ismail there joining us from the Western Cape with an update ahead of the deployment of members of the SANDF to assist the province as it responds to the second wave of the coronavirus with this new variant that's now in play in this situation.